Welcome to Gen Z and mental health at work. In 2025, Gen Z is projected to make up 27% of the workforce, but coming of age in the workforce against a backdrop of rising mental illness presents unique challenges for this generation. At the same time, workplaces have a powerful opportunity to positively influence the mental health and well-being of younger employees. Black Dog Institute acknowledges the Bidjigal clan of the Darawal Nation, who are the traditional custodians of the land on which Black Dog Institute is situated. The work we do at Black Dog Institute stretches far across this land, and we acknowledge and pay respect to all First Nations peoples and communities and their continuing connection to land, waters, and community. We recognise that their customs and culture have nurtured this land since the first witness sunrise for the benefit of all who live, work, and learn on country today. We pay respect to elders past, present, from all nations across this country. Today, we're really fortunate to have a wonderfully diverse and experienced panel group. I'd like to introduce you firstly to Dr. Mark Deedy. He leads the Work and Mental Health Research Program here at the Black Dog Institute, is a senior research fellow at UNSW, and has worked in the field of mental health research since 2008, and is an international expert in occupational mental health. We're also joined by Pam Withy, who's a clinical psychologist working in private practice, providing treatment for people with mental health conditions and a facilitator for Black Dog Institute's workplace and health professional education programs. She has nearly 25 years' experience working in government, private, and corporate sectors, along with working with young people. Imsha Mirzabayeg is a workplace safety, well-being, and mental health practitioner with deep expertise in psychosocial safety and holistic well-being. With experience crafting and leading work health safety management systems across complex, high-pressure industries, has worked with diverse workforces spanning multiple life phases. Finally, Rahana Rahimi is an operations analyst with KFC SOPAC. She began her career at KFC as a team member in her first job and worked her way up to become a restaurant manager, gaining first-hand experience of the challenges and opportunities faced by young workers. In her leadership roles, she has been committed to building safe, supportive, and people-first workplaces where young team members feel valued and confident. So today we're looking at a really big topic, mental health amongst Gen Z. It's huge. So we definitely aren't going to get to everything, but we've handpicked some questions that we think will be really insightful and helpful for our diverse audience today. So we're going to start with Mark. Based on your research, what do we know about mental health among Gen Z in the workplace today?
Thanks, Carolyn. Yeah, it's obviously, as you suggest, it's a huge topic. So I think, I think it'd be nice just to focus in on a few things we do know. I mean, I think I'd like to preface this sort of conversation because I have done a few of these presentations around this topic, and it is a funny one because people do come with a lot of their own experiences, and there's an accepted notion a lot of the time that this is one of those isms that's sort of still kind of okay, still okay. We sort of hear about, very much an acceptable kind of stereotype when it comes to Gen Z or any sort of cohort that we sort of discuss. There's often this idea that those stereotypes really fit and we sort of hold them tightly. So I guess I sort of wanted that to kind of just throw that out there before we jump straight into everything, because I do think it's an interesting piece when it comes to this particular population. I guess starting off, we do have this consistent message that we see, coming through the media about this rising, I guess this sort of rising epidemic of mental health issues, and it's sort of been that way for a while now, but it's probably an increasing conversation. And at some level, there is an alarmist sort of sensationalized topic there that kind of gets discussed, but there is data highlighting that national sort of health survey data in Australia highlights the steady climb of psychological distress in younger populations, in certainly that working age population, particularly over the last sort of 10 years. We've seen a pretty steady rise in that data. And I guess this has particular flow-ons to workplace. We've seen this increase in distress really spike amongst, it's sort of across the board, but we really see a spike, especially recently, younger females. That's probably the most notable jump. We see that sort of movement in that direction across the population, but particularly young females, that rate has increased to the point that it sort of increased at a rate of sort of 10% over the last 10 years. So it's really significant numbers, especially in that population group. And we don't have the most recent data on that, so it's a few years old now. So we're waiting for the next piece of that data to come through to see where we've progressed in the last couple of years. I guess in terms of the research I've done, I suppose I wanted to speak specifically to one piece of work that we've been working on has come out early this year. And it was really, we wanted to sort of unpack this a little bit and work out what's going on in terms of this issue. And if we are really seeing these rates of mental health within the workplace increasing, especially in this younger population, what are the causes of that change? And is it the fact that we're seeing a change in the prevalence of risk factors, workplace risk factors for poor mental health, is that changing over time, or is it a case that we're seeing the strength of association between those risk factors and mental health changing? So what I guess I mean by that is this idea of, is it a workplace change, or is it a change in the workforce, as often kind of gets pushed in the media that, a younger generation presents quite differently in terms of risk and protective factors. And I know I'm sort of racing through this and it's a little bit dense to kind of get through, but what were some of the key things we were looking at were the risk factors and protective factors of job demand and job control. And that we know that historically these have really been associated with impact when it comes to mental health. So having lots of job control is a good thing. That's autonomy, flexibility in the work you do, versus having high demand being a bad thing for our mental health. And really, what we found there is over the last 2 decades, the population prevalence of high job demands has increased in younger populations, especially, while it's not really been a change in job control. But what was really probably most interesting is that the negative effects of job demand, so high stress, that feeling that your job's going to make you quite ill, those negative effects on mental health were higher, significantly higher within the youngest cohort. So what that indicates obviously is that they're faring worse under the negative impacts, whilst the benefits of control were dramatically reduced in the sense that, so that younger population is experiencing the negative effects worse, whilst they're experiencing the positive effects, that sort of control, the benefits of control, less. So I sort of racing through a bit of a specific study, but I think it's enlightening to see that there are these sort of different pushes and pull factors that might be going on within the workplace environment. We also know that younger populations are bringing different things to the workplace. There's a number of social and economic factors as well going on, but there are a number of workplace factors here. I guess the last thing I want to say is probably related to that other side of things. We do know that there is significant impact when it comes to what's going on, I guess, outside of a work context. So I guess that study specifically was looking at within a workplace context, but we know that there are a number of financial and social issues facing young workers. A big population survey recently found that the Gen Z and Gen Y were more vulnerable to psychological distress and burnout, which was as high as sort of 80% within that particular survey. And this was leading to an increase in mental health claims within younger workers. And I think why I wanted to mention that is that what they found was the boomer generation doing much better, moving into retirement, planning, that sort of thing. However, they were doing worse when they were under financial distress. And I think that sort of this idea that it's so much of this relates to resourcing and the economic, social, that sort of thing. So there is this element here that I think is important to bring into this conversation, is just the idea that, often it's a case of not necessarily the age specifically, but what the younger workers are kind of going to bring into that. And we know that there are a number of external pressures kind of going on within that younger workforce, especially in that sort of COVID and post-COVID era.
Yeah, that's fascinating to think about the financial challenges and how it's affecting not only Gen Z, but other generations as well. And recognizing that when people turn up to work, they might be bringing a whole heap of different baggage to the situation that can then impact their ability to respond to, as you say, challenges in the workplace. So we'll head over to Imsha now. Have you seen younger workers' expectations around workplace culture and well-being change in your role?
Thank you for asking. And I feel that a lot has changed, but it has changed for good. And looking at a mix of wider industries and focusing mainly on fashion and retail where I am now, it attracts a lot of young workers. It's just the type and the scope of work. And often you would see it is their first role. So this is the very first time they have stepped into a workplace. There's lots for them to learn and explore and be savvy with. Now, some of the things you would see that well-being for our younger workers it's part of everyday life. It is not like a perk or a benefit that you would get from a workplace. And that's where the challenge comes for the workplaces to design an ecosystem where they really can unpack what it means for different worker types and worker cohorts. And what they mainly seek out for is that real support. And I often say, it is not like a fluffy thing that, oh, yeah, we have got all these amazing programs and benefits in place. But the real essence actually really comes in that what they want and what it actually looks like for them. So just talking about, the three big things which I always say and ask, that our younger workers, it is their first time being part of the workplace. What they seek is to be heard. They want to be seen, they want to be supported, and they want to see a real difference that the workplaces can bring into their life journey. And very quickly to close out, I've seen a big trend change where the young workers are really invested in diversity and in inclusion, and they want to be part of this wider culture where they have a voice as well. So the well-being is not just a single tool, it actually comprises of a lot of factors that can play a big part in the workplace. And finally, it ties back into the psychological and the psychosocial factors in the workplace as well.
Thanks, Imsha. Pam, in your clinical experience, you've supported young people with mental health conditions as they transition from education to workplace environments. What have you noticed in that transition?
Thanks, Caroline. And Imsha, what I've got to say really does follow on from what you've talked about, because they're in their very first job. As a clinical psychologist for many years, I've really specialised in working with younger people. So I have supported a lot through education, getting to know them while they're working on improving their mental health through high school, and then entering the world of adulthood and their first ever job. So that transition from education to workplace can be really challenging. So in high school, it's really common for young people to have a positive experience of disclosing mental health conditions. The school might encourage it, and they then get tailored support for their condition. Some of the support they get from school in education, they don't actually need. It's kind of offered to them as a bundle. When you've got this diagnosis, you can fill in this form and then we can offer you these things. So when these young people enter the workplace, it can be a bit of a shock as there's less support and potentially even adverse consequences from disclosing their condition, which they'd not experienced before. So while a manager may be supportive of their team member disclosing a mental health condition, the young people are sometimes surprised by the stigma from other workers, including workers from different generations. And the kind of support that they were offered in high school might not be appropriate in work settings. And due to their limited experience in work settings, they might need explanations about the expectations about managing their own mental health in the workplace rather than have other people respond to manager for them. They might need a bit of a supported discussion around what the expectations are of a worker in the workplace. And as Gen Z are the newest generation of workers, we also have to think of them developmentally. So this is where I put my clinical psychology hat on, and we just talk about their stage of development. So young people with mental health conditions that have impacted them in adolescence, what coping skills you use to manage your mental health will change at different developmental stages. So what a child does to manage anxiety is different to what they start to do in adolescence. And it again has to evolve and change for adulthood. Now, they may start to experience this for the first time in workplace because workplace is their first adult setting where they spend the majority of their time. So some of the skills they used to use to manage their mental health might not work as well as it used to, and that needs to change and evolve through maturity and through their experiences. So it's also a time of increasing independence. And so this might mean less contact with their everyday supports. The people that used to know and pick up on the early signs of a struggle and maybe prompt or provide early intervention to help them to manage their mental health, they might not have everyday contact with them anymore. They're starting to increase their independence in understanding their own health and responding without someone else prompting it. And understanding and a supportive manager doesn't become their parent, but actually starts to become very helpful to prompt or notice things, talk about it, and that gives that young person cues to work out how they're going to manage it on their own. And that helps this next generation have this next developmental step in their own mental health management as well.
Thanks, Pam. That's fascinating thinking about it through that developmental lens. Mark, we'll head back over to you. What role do managers play in supporting the mental health and well-being of younger workers?
I think some of this has been touched on, and in the workplace in general, managers have a really pivotal role to play when it comes to mental health within the workforce. And I sort of don't say that to put excess pressure on managers. Managers are employees too, and they come with their own set of stresses and all that stuff. But what we know from the studies we've done is that workers who view the mental health as a priority within management, and also workers who work under specific managers who they view as supportive when it comes to mental health. We know that there's a very sort of linear relationship there between those factors and reporting of psychological distress and well-being. So the more the worker views the manager as supportive, feels that they're being supported at a mental health and well-being space, the more that they view management as having this priority around mental health. We know that comes with huge benefits for well-being, and it's associated with greater well-being and less distress. And I think this just highlights the role of managers across the board. And we know this from all sorts of industries, and it's really notable in high-risk industries where there's even studies looking at the rates of post-traumatic stress amongst different groups that are exposed to armed forces, that are exposed to same scenarios with supervisors that they felt were supportive and others that weren't, and rates of post-traumatic stress in those conditions are markedly different. So it's really, managers do have this kind of critical role to support. And when it comes to this younger generation, one of the things that's kind of critical, maybe slightly different from a managerial standpoint, is that, as it sort of was alluded to, both Imsha and Pam mentioned this idea that this is often a new relationship. Younger workers obviously also come with power imbalance as the greatest level of anxiety, presumably, and trepidation around seeking support and seeking clarification, all those things, because the younger workers don't always know when and how to ask. So I think the managerial role here, which is really important, is making space and making time to check in more regularly with younger workers and to ensure they're performing tasks correctly, they have the support they need and are able to speak up when and if they need, and also being able to foster good relationships with those workers. And this goes for all sorts of workers, but to be able to understand what those younger workers, what might look like normal behavior, I suppose, in this sense, so that managers are in a position to see if and how things change, and thus be able to step in and potentially facilitate help seeking, or just check in with those workers and see how things are going and if there's issues developing, in line with this idea of still making sure that any sort of contacts for support services are facilitated possibly more with a group that is unfamiliar with concepts like an EAP or the other support services that may exist and may be more commonly known to workers with more experience, but may not be at this sort of younger level. I mean, this comes back to sort of the judgment thing I raised earlier, I suppose, as well, this idea of making it just a genuine effort to meet workers where they are and at whatever age, and with sort of coming at it with sort of empathy and sort of positive regard is sort of the critical thing.
Thanks, Mark. Rahana, I'm really interested about your journey. Can you tell us a bit about your progression and how important good mentorship and management was to your well-being at work?
Yes, of course. So I started at KFC as a team member as my very first job. And like many young Australians stepping into the workforce, I was nervous and obviously unsure of myself. What made all the difference was having managers who went beyond just teaching me the technical side of roles. For example, I remember one of my manager who would always take a moment after a busy shift to check in with me and ask how I was coping. If I made a mistake, they framed it as a learning opportunity, which helped me build confidence rather than feeling discouraged. I think those small but consistent moments of mentorship made me feel supported and safe at work. Over time, I worked my way up through different roles and eventually became a restaurant manager. That was a turning point because I found myself on the other side. Well, now I was the one supporting our young Gen Z team members, being a Gen Z myself, and many of whom experiencing their first job role just like once I did. That shift showed me how important it is not to only mentor but also keep our team safe. Working in restaurants can be fast-paced but also stressful, and our culture is built on looking out for each other. For example, our Kentucky Fried Check-in is a really simple but powerful tool for leaders to use if a team member looks like they're struggling. Our safety team constantly provides guidance so managers can also respond quickly and effectively. For me, well-being at work is a mix of having leaders who care, a culture where we support each other, and a system that keeps our people safe, shows KFC's strength in people-first culture. And also beyond our restaurants, I am proud that through KFC Youth Foundation, we're also supporting, helping to improve youth mental health more broadly, including through our partnership with the Black Dog Institute, knowing that our work supports young people, not just inside KFC, but also across the community is something really special to me.
That's so lovely to hear. Thanks, Rohana. Imsha, can you tell us a little bit more about some of the initiatives that you run to support younger workers at the Iconic?
I'm very proud to say that here at the Iconic, we foster a safe and mentally healthy workplace. So what that actually means that we just don't look as like well-being part of like an element of something, but we look at the employee journey. So it is the end to end, and it all kind of like takes charge of the life cycle. And then based on that, there are different cohorts, because as I always say, that well-being is not a blanket approach. It has to be fixed on a risk management cycle and that kind of like of a mindset. So some of the things which I think that would really help for someone to kickstart is to find the purpose, and that then leads and helps you to build that framework and have like a structure approach, because most of the times you would see that organizations would start an initiative, start a program, but if it's not embedded part of the bigger strategy and what the goal and the final outcome looks like, often it gets missed out because there's so much that actually goes on in the workplace itself. So the top 5 things which I would say, and I have seen that has worked from time to time, is that being proactive in this space, having that preventative mindset. So don't wait for things to go wrong, but really go and have a stroll and find out that what can go wrong here in the workplace, right? Assessing the risks and building a support ecosystem. Now, I would say, if I have to put my hand on my heart and say that, hey, are we taking care of our people? So I always look at that, what we have built and how the system works, and to make the system in a way as well that it actually works for itself. And this is where like the magic and the beauty comes in. And the very last one is the education and awareness. You can never go wrong. And I feel that when people don't know something, they always have this stigma and fear to take that step one to go and reach out. And that's where the education and awareness comes in. So this year we also partnered with Black Dog. Well, I have been working with Black Dog for a long, long time, my whole life cycle. But I would say that some of the programs and the strategy, the training that they have provided in our workplace, that has helped us a big deal, which is all science-based and very evidence-based. And it actually really goes back to that, to understanding the why. And once we get the why, the rest just rolls in. So that's where I think the big things come in. And as I always say, I'm a big advocate for it, that well-being is everyone's business. It is not the manager, it is not the employee, it is actually part of a workplace system. So keep those hats on and let's just keep thinking about it.
Thanks,
Thank you.
Imsha. That's a beautiful philosophy, and thanks for your partnership with us. Pam, what are some practical tips that you would offer to managers of younger workers on how to support their mental health and well-being in the workplace? And we've also had a question related to this about how might we balance our own experiences of self-care and finding the line about how much of that we might share, tips we might have picked up on our way, like exercising or drinking less. How might we share them or support a team member?
Okay, I'm going to answer that question, but maybe in the middle of what I've got to say. I think it'll fit in really well there. I want to start with Rahana's comment. I told her before we started that both my sons work at KFC in their first job. And I can tell you that when they got a shout out in the group chat about something that happened at work, they came to me all excited and showed me, this is what someone said, everyone's seen this now. I think that's just a beautiful example of those manager actions and ways to support people. Because not only does that one person get a bit of a self-esteem boost from that, everyone gets to see what's acknowledged, what's admired about working here. So that's not just about work performance, but sometimes it's about your attitude to work or your support of another worker. And I just think that's a great example of a practical tip for a manager to take that's in line with what Rahana experienced herself and then continues to support her staff to do. I think to answer these practical tips for managers, I think we need to think about individual people who you manage, as well as the overall workplace environment that Amsha was talking about too. So managers often get their role through knowledge and experience of the job, but may have never had people management skills. And sometimes they're really unsure about what they can say. I hear this all the time when I'm doing the Black Dog Institute, the Managing for Team Wellbeing training sessions. Managers say to me, oh, I didn't know we could say that, or are we actually allowed to ask about non-work things? And they start to ask a lot of what if questions. What if they get really upset, or what if I don't know actually how to help them if they share something with me that's happening. So these are really great training sessions where we can understand what managers might be experiencing and then help to skill build around that so that they can improve their confidence when it comes to people leadership. So manager training and support in creating that mentally healthy workplace culture is really vital for managers, both individual and for their teams as well. So some practical tips for the managers is similar to what Mark was saying, really. Active listening. This means let the young person have a bit more time to explain things to you. Even if you already think you know what they're talking about, don't rush into a solution. Just let them talk a bit more and show your active listening. As they're talking about it, they're also processing it differently for themselves. That's part of them improving their own mental health as well. Show empathy, show that you care, not just in your words during that first conversation or those specific conversations, but in other times as well. Like the group chat at KFC, you can show that you care by following up with someone a bit later, by showing that you still remember something we talked about previously when I'm thinking about this next task as well. And sometimes it's simply just with a smile or a nod of encouragement, right? And supportive communication. Some young people in the workplace, they know how to talk at school, but the way teachers talk to them is sometimes quite authoritarian. When you enter the workplace, you start to need to learn how to talk to people as equals. Mark talked about that power imbalance, which is definitely there, but young workers need to learn how to shift that power imbalance and what's appropriate and what's not, with a bit of guidance. So supportive communication, when a manager can talk and communicate in ways, that's really helpful. It demonstrates this kind of language to young people as well. And when it comes to mental health, try sticking to the facts in this supportive communication rather than assuming things. And that might mean, if you're sharing your own experiences, only share what's relevant to keep it focused on the young person or what's happening for them, rather than assuming they're experiencing something. If they say, I have depression, and you've had it before too, if you go too much into your own experience, it might then not really be part of what this young person is experiencing. So supportive communicating, sticking to the facts that this person shares with you, working with that in a way so that they don't feel judged, they feel supported and safe to talk more, keeping it confidential, letting them know who you need to talk to and why is really important so that they know what's going to happen next with their information as well, and don't start to worry about it. And workplace considerations, thinking about that work environment, Imsha really talked well to this. Managers are really of key importance when it comes to creating that safe and supportive working environment. So this might mean changing the way things have been done before to reduce stigma or to reduce other unhelpful work processes or work behaviours. For example, there has been a culture in some workforces, such as apprenticeships, where there might be first-year apprentices experience some jokes or some hazing as part of their work. And it could be a part of a rite of passage. People talk about it. It could be part of a culture that's been there for many generations. This is what I went through, and this is how you enter the workplace. But we know that this kind of hazing can be dangerous and can cause harm, and it's not consistent with safe and respectful workplaces. So managers will need to support all workers to understand what's reasonable fun and jokes at work, because we do like that, what has the potential to cause harm, and how to support a whole behaviour change for people of all generations. So a culture shift can be really challenging to start. So Imsha said, we start with the why and then the rest can fall into place. And I think that's really a great way of explaining it. sometimes we need a starting point, like a team training session where we put it all out there, share the initial learning together, and then we can start to live it through the next weeks or months in work actions. And this can start to create a culture shift, because then the culture shift isn't coming from the manager telling the staff what they can and can't do. It comes from the staff together using information and then starting to live it, which is where we can create some really healthy workplace culture. And also considering the workplace, the environment, and Mark talked to this too in the research. Everyone has mental health, yeah, and everybody has different ways of managing their mental health and coping with work stress. So people are different. What works for one person as a coping strategy for work stress might be really different to somebody else. So this often gets voiced when I do building resilience to workplace stress training, where staff members in a team doing the training together will say, oh, I didn't know you did that, or is that what you're doing when that happens? So to start to talk about, for all people, we all need coping strategies for work stress. It does support our mental health, and to have them talked about and built, you can learn and build more coping strategies for work stress, which are actually coping strategies for life stress as well, can be really, really helpful and important. And workplaces are a great way that we can do that within the context of workplace training, but actually you're helping people build themselves. And for managers to be aware of all these different coping strategies and what staff's individual preferences are, that can help them to manage well, so that we can prevent misunderstandings from occurring, which then increases work stress, and understand it and support it, which then can decrease work stress.
Yeah, that's beautiful, Pam, that workplace training is not just about what happens in the workplace, but actually giving people skills for life. Thank you. Mark, we've talked a bit about the role of managers up until now, but what other changes do you see happening in workplaces that might benefit younger workers?
I think we've seen a number of significant changes in the last few years when it comes to workplace mental health, and again, this increasing focus in the area, which I think is a great thing. Obviously, one of the big movements nationally for Australia and also internationally is this idea of psychosocial risk management, and it obviously gets a lot of press. So with the change in the regulations, this has always been a big push around what it means in terms of identification of risk and hazards, and then how to then mitigate them. And this is obviously going to have particular impacts to everyone, but young people are going to be affected by some risks probably more than others. I mean, we know that younger workers report greater levels of bullying and harassment, for instance, which is a particularly impactful risk factor when it comes to poor mental health. So there's a number of risk factors that exist, and they have different levels of impact at a mental health level, and something like bullying and harassment is quite significant in terms of that impact. So I suppose for me, this idea of organizations developing better policies around anti-discrimination, around harassment and bullying, and that zero tolerance idea when it comes to anti-bullying in the workplace. We know that there's not a lot in terms of interventions that have been shown to be that effective in terms of bullying. So really at an organizational level, being on top of it and really strong policies in place to where that occurs in terms of being able to report and being able to act on those things. I think for me, though, this idea of the right to disconnect is another big one that's come up. I mean, I think that's interesting to me, because I think what we're seeing in young people in this idea as well, potentially of that, the research I mentioned earlier, potentially a change around control. There is a bit more of an expectation of within younger populations around flexibility at work. We see that shifting across the board, and younger workers in particular are often coming into workplaces where they may have greater flexibility than previous generations. I'm intrigued to see where that goes. I think that could be a positive and a negative. I think this idea of being always available to respond and the expectation to always be available to respond is impactful when we think about work-life balance. And I know that I'm sure everyone today has sort of had that experience of trying to the difficulty, an increasing difficulty, I guess, in being able to keep work and life separate, and making sure we have the space to do that. And I think that to me is probably a critical thing to consider in this idea of possibly how to make that right to disconnect, bring truth to that, and really live that. Also this idea of living, like of bringing attention to workload management and bringing attention to, I think that idea of being able to have protocols and expectations around time spent offline and using leave and that sort of thing, and having leadership that demonstrates that and models that, I think is really critical thing to moving forward, I think, in what we'll see in the future when it comes to mental health within the workplace.
Yeah, that importance of role modeling wellbeing behaviors is so critical. Rahana, what would be your one piece of advice to your peers?
Yeah, so my advice would be to remember that many young Australians, this is their very first job, and the way we support them can shape their entire view of the workplace. Taking the time to listen, check in, and show genuine care makes all the difference. Here at KFC, we have over 44,000 young Australians working in our 800 plus restaurants, and a lot of them are navigating challenges in their lives outside of work. And by using tools like, KFC Fried Check-in and building a culture where we look out for each other, we give our teams the support they need to grow. I would also encourage my peers to lead by example by being, approachable, recognize their efforts, and creating an environment where young people can feel like they belong. And it's also about building trust, ensuring they know their well-being matters just as much as their performance. I've seen it firsthand. When I was managing a team, I noticed that one of my younger team members seemed really withdrawn during the shift, and I used the Kentucky Fried Check-in myself. Asked how they were going, how they were doing, and it turned out, they were struggling outside of work. We were able to adjust their shifts, giving them some time off and provide support resources. That small act showed that we really cared, and it made a huge difference in their confidence and well-being. And it's also about creating an environment where young Australians feel safe, valued, and supported.
Thanks, Rahana. That's such a beautiful example of looking after your colleagues and your team and how that can go such a long way. We certainly see that reflected in the research. When managers look after their team, it really makes a huge impact. So for anyone interested in doing some workplace training, like what the Iconic have done with Black Dog Institute, we offer a whole range of training, including training around psychosocial hazards and a managing for team wellbeing training, which has been found to have a 10-to-1 return on investment just by giving managers the skills to look after their team. So there's lots of resources available if you're interested, and you can reach out to us on workplace@blackdog.org.au if you'd like to learn more. We'd really appreciate you taking a moment to share your feedback about this webinar. We are constantly evolving and improving our programs. So if you have any feedback about today's session, feel free to use a QR capture on the screen, or when you wrap this session, there'll be a pop-up with the questionnaire available as well. Thank you everyone for joining us today, for taking time out of your day. We really appreciate it and hope you learnt a little bit more. We certainly have had a really great discussion today, and I really appreciate everyone joining us. Thank you.